Hello, welcome to Insight Explore. Please don't forget to subscribe to our channel. Canada will legalize medically assisted dying for people addicted to drugs. Some drug user activists have likened the move to eugenics and say Canada should be funding more harm reduction. Canada will legalize medically assisted dying for people who are addicted to drugs next spring, in a move some drug users and activists are calling eugenics. The country's medical assistance in dying MAID law, which first came into effect in 2016, will be expanded next March to give access to people whose sole medical condition is mental illness, which can include substance use disorders. Before the changes take place, however, a special parliamentary committee on MAID will regroup to scrutinize the rollout of the new regulations, according to the Toronto Star. Currently, people are eligible for MAID if they have a grievous and irremediable medical condition, such as a serious illness or disability, that has put them in an advanced state of irreversible decline and caused enduring physical or psychological suffering excluding mental illness. Anyone who receives MAID must also go through 2 assessments from independent healthcare providers, among meeting other criteria. The contentious idea of including people who are addicted to drugs is being discussed this week at a conference for the Canadian Society of Addiction Medicine in Victoria, British Columbia. However, some drug users and harm reduction advocates told Vice News they're upset the idea of drug users being given access to MAID is even being discussed, as they feel other public health measures, including better access to overdose prevention sites, opioid agonist medications like methadone, a regulated drug supply, housing, and employment are lacking. Martel, who has been a MAID provider since 2016, said he agrees that healthcare options for people with substance use disorders are underfunded, and that he hopes this conversation will draw more attention to those concerns. He said he hasn't heard a desire for assisted death from his patients who have substance use disorders, and it's not something he's sure he would raise as an option, unless he was involved in end-of-life planning. He said, "The idea that we might promote or push this on people, that doesn't resonate with me at all. Even if someone with a substance use disorder was approved to receive MAID, he's not sure he could be the one to help them end their life." Martel was part of a Nova Scotia working group that included doctors, psychiatrists, ethicists, and policy analysts. He said some of the criteria they discussed included requiring an assessor who had expertise in treating substance use disorders, if that was the motivation for the MAID request, and assessing what type of treatment the person had received and for how long. He said, in addition to having a mental disorder that has been there for a very long time, and that is significantly impairing their function, treatments have to have been tried, and those treatments have to be treatments that are expected, usual, and evidence-based. But there's no one-size-fits-all answer to what that could mean. He added, "One of the problems that we had, I think looking at it with that lens, had to do with the fact that we don't really have a whole lot of guidelines when it comes to addiction treatment. There's still a lot of debate about it, but of the ones that do exist, we need to know that those have been tried. Opioid agonist therapy, which involves giving people medications like methadone or buprenorphine to help control their cravings, is considered the gold standard for treating opioid addiction. But Dodd said that those medications aren't easily accessible to everyone who needs them in Canada." He added, "I know people have to travel several hours to get access to what they need in the more rural places." Martel said assessors will also need to be able to distinguish whether someone is suicidal or has a reasoned wish to die. The former might be linked to a more acute crisis, or be a feature of a long-standing psychiatric condition, while the latter applies to someone who is thinking in a calm and measured way about wanting their suffering to end, being able to reason through it, Martel said. But he noted a person can exhibit signs of both, making it an even trickier ethical ground to navigate, and that it would be fairly impossible to make the distinction if the person being assessed was intoxicated. As Canada prepares to legalize MAID for people with mental disorders, each province will have to develop its own protocol for how to assess people. Dr. Simon Colgan, lead physician for the Community Allied Mobile Palliative Partnership, which provides palliative care to homeless people, said MAID requests must be understood within the context of a person's lived experience, and this takes time and relationship. He said any MAID protocols for people with substance use disorders should be made with the input of people with lived experiences. Karen Ward, a drug user activist in Vancouver, said she considers the expansion of MAID to include people with substance use disorders a statement in federal law that some people aren't really human. The government has made death accessible, while a better life remains impossible, she said. Homes for all, guaranteed dignified incomes, access to healthcare, education and employment, these aren't radical demands. While there have been fears around a massive influx of people wanting MAID assessments once the new regulations kick in, Martel said if tried properly, he expects the number of people to qualify to be relatively low. This involves the applicant answering a series of tick-box questions and signing the bottom, followed by securing the signature of witnesses. There will then be a phone call and home visit from a doctor. If the application is approved by two separate doctors, the person must wait 90 days from the time of their application, and then a doctor can administer the lethal drug via injection. Currently, people solely with mental illnesses, such as depression and personality disorders with no physical conditions, are not eligible for assisted suicide. A framework for assessing people with substance use disorders for MAID is being discussed at an annual scientific conference held in Canada this week. The agenda for the workshop includes teaching attendees and medical professionals how to know the difference between suicidality and a reasoned wish to die.